Everyone, my topic is endometriosis today. And what is endometriosis? It is defined as the presence of endometrial glands and stroma outside the uterus. It is a common and benign form of disease which is found most commonly in the reproductive age group and adolescent group. Its prevalence rate is 30 to 50% of endometriotic female, they are infertile, and around 20 to 30% who are infertile, they have endometriosis. What are the risk factors and protective factors of endometriosis? Risk factors can be uh, female who have early menarche, secondly heavy menstrual bleeding, right? And other risk factors can be delayed childbirth or a history of first degree relative having endometriosis. The protective factors can be eating diet rich in vegetables and fruits, firstly. Secondly, delaying lactation. And the thirdly is multiparity. Now we come to symptoms. Basically, the symptoms the patient present to us with a complaint of pain during the periods, firstly, which is dysmenorrhea. Then the pain during intercourse, pain during urination, during defecation, and very important symptom is basically the infertility. Patient present to us that she is unable to conceive. It can be menstrual irregularities can also be symptom, and the chronic pelvic pain. She can come to us with chronic pelvic pain also. Now, basically, the diagnosis of endometriosis should be made by patient's history, clinical examination, and imaging. Imaging comprises of first line is the ultrasonography and then MRI, right? If needed, then the patient can also undergo diagnostic laparoscopy as when needed, because diagnostic laparoscopy is the gold standard for the diagnosis of the endometriosis. But now the management part. Management comprises of medical management and the surgical management. Before telling you about the medical management or surgical, I would like to tell you about the two goals which we work upon. One is a short term goal and the second is a long term goal. Short term goal for endometriosis is to get the patient relief with the pain, firstly, and secondly to help her conceive fast, right, which helps in fertility. Long term goal can be to decrease the progression of the disease, right, and the secondly to prevent its recurrence after therapy. Medical management can be by progestogens, GnRH agonists, OCPs, GnRH antagonists, aromatase inhibitors, danazol, NSAIDs, etc. Whereas the surgical management comprises of conservative as well as radical. Conservative management comprises of adhesiolysis, cauterization, Luna, laser technique, cystectomy, cyst aspiration, etc. Whereas the radical part comprises of total abdominal hysterectomy with or without bilateral salpingo-oophorectomy, or if there is bladder involvement is also there, or ureter involvement like the ureteric resection can also be done, bowel resection can also be done. Like this was the surgical part. Now last but not the least, we can conclude that it is not a curable disease, but it is a treatable disease. We can control the disease to so that it does not lead to severe progression. So if so, early diagnosis is needed so that early treatment can be done. Basically March is the month of endometriosis awareness month, right? So be safe, be happy. Bye bye, thank you.